Hello everyone and welcome to this audio podcast. This audio podcast as part of a Calyces Chronicle series. This audio podcast as part of a MaelZtorm Cortex. This audio podcast as part of the Notwithstanding analysis. This audio podcast as part of a Storm Robotics production. This audio podcast will look into the various and the varying themes derived by highlighting or by providing a basis in around the different themes derived. So in around theme one and lack of coping definition in around chronic kidney disease. So coping is not a standalone phenomenon. It encompasses all changes as they occur during continued exposure to a challenge. Coping is an influential intermediary of expressive consequences. Encouraging outcomes are related to particular coping processes, and undesirable outcomes are related to negative coping. Um, authors or investigators, for example, Folkman had claimed that optimistic feelings are a normal element of the coping process, process, and these support psychological coping. So people who are well proficient and positive are capable and so less exposed towards the stresses in time. If someone underrates prospective action, no coping strategies will develop. This has been emphasized also by works by Schwarzer by Schwarzer as well. Lazarus was one of the sort of main investigators around coping research who provided the first definition of coping relating to harm, to number one, harm, two, threat, and number three, challenge. Harm and loss refers to injury or damage or loss of physical function and self-esteem. Threat can mean the same injuries refer but yet to happen or anticipated. And challenge can mean the opportunity for development, strength and ingenuity. The distinctions between these three concepts are not only important in coping specifically, but have a crucial role to play in health and disease. A second definition developed jointly by Lazarus and Folkman, who asserted coping can be problem-focused coping or emotion-focused coping. Problem-focused coping involves strategies that attempt to ease or eradicate a challenging circumstances by gaining hegemony and balancing advantages and disadvantages, and crucially, personalities who adapt this approach also subdue feelings. So, for example, evading or procrastination. So, for example, in around exam revision, or replaced by communication, or procrastinating in other ways. Emotion focused coping also involves approaches to smooth, emotive, or possibly challenging events. Coping also depends upon appraising whether and whatever can be carried through to modify a state. If a challenging situation can be approached to ease circumstance, problem-focused coping dominates. Otherwise, in challenging situations, emotion-focused coping predominates. Following some of the work by Lazarus, a research team or investigators carried a series of basic surveys where three questions set out to be answered surrounding young people with cancer. Number one, how might cognitive and behavioral methods of coping with chronic illness impact on perceived support of one's family? Number 2 are coping approaches of relevance and importance in determining and explaining differences in support. And number 3 are quintessentially distinct domains of family support and coping identifiable in this group. And based on the data from 169 patients with cancer, results suggest that problem-focused strategies for coping are more effective. Five coping strategies have been further identified from the investigations. Number 1, seeking social support. Number 2, reflection. Number 3, threat minimization. Number 4, turning to faith. And number 5, seeking information. So while several papers discuss coping in young people, young people, in young people, exploring exploring the literature more deeply had highlighted a lack of coping definition of young people who have CKD, and youngsters who have this chronic condition, have this chronic disease, face long-term challenges, which means there needs to be more support systems in place. Further, young people who have positive coping strategies could potentially make strides to self-care, allowing better transition into transition from young services into adult service into adult healthcare services into adult healthcare services, and strides had increasingly been made to assess coping in young people with chronic illnesses such as CKD, because youngsters have their own understanding to challenge the illness. A definition of coping with CKD is important because evidence suggests that there's beneficial association in coping and how well youngsters manage the disease or the condition. Also, characteristics such as resilience may be inherent in some individuals. So in around theme two, and looking at coping strategies in young people and coping strategies in young people with CKD. So several investigations inform coping strategies in young people, in young people, in young people and citing the literature. An important point to be made is that youngsters with CKD may cope differently from healthy peers, because they may have experienced diverse coping strategies because of the greater experience with coping and trauma. CKD stages 4 and 5 potentially leads to the requirement of a form of renal replacement therapy, and extensive changes projected to be challenging, thus requiring diverse coping processes. And for young people with CKD, coping can mean a lifetime of ill health. The change of psychosocial concerns that young people with CKD and families contend with has been documented. Young people with CKD differ from young people with other illnesses such as brain or spinal cord tumors, high arterial blood pressure, leukemia, and other primary conditions, in that this illness requires a lifetime of varying interventions, and even after in around renal transplantation. Early literature exploring coping in young people with CKD has highlighted that the reactions are a continuum which changes from acceptance of illness to rejection and denial. Coping may take either a positive or negative form. When a disease is intricate like CKD, denial has also been identified as a typical attitude. Anxiety is also common, and it has been noted that young people's overall adaptation to renal replacement therapies, for example, hemodialysis, can be fairly good. They're progressive sometimes. Progressive, sometimes spectacular physical healing, contrasting with previous morbidity, seems to brush aside the psychological issues. sort of mixed methodology investigation, works by early mixed methodology study, Rosach investigation or psychological, which is a psychological assessing a psychological assessment, and where the perceptions the perceptions of ink blots and analysis of interpretation are part of the investigations, were carried out on 24 young people with CKD during the time they were undergoing hemodialysis, and 1 year post and 1 year post transplant. Investigators also carried out interviews with young people with CKD and families, gathering drawings and commentaries. Coping process and strategies adapted appear to be related to traumatic experiences and a lack of support in mastering them through verbalization expression. For example, letting members of the healthcare team know what is specifically difficult for them. The authors conclude the major difficulties manifest themselves in coping with personal or in around personal concerns, or can be around personal concerns. Humor has been found to be quite an important positive coping strategy in young people with chronic illness. Young people's use of humor during interaction should be investigated as an intervention, because when young people use humor, this could mean something distinct. This author from 2000, an author from 2000 in works in 2002, gives examples of interaction, ultimately suggesting there is a need for further research to evaluate humor as an effective intervention coping strategy. Individual traits such as humor, autonomy, enthusiasm should be examined for significance in relating or regarding to coping strategy and resilience. Research should focus also to identify the presence of such traits, and there are peer review works from as early as from around 19 late in the late 90s up to 2004 for further works around humor as a coping strategy. In around theme, sorry, yes, and additionally, sorry, young people with CKD were recruited to examine coping strategies and manage their chronic illness in an investigation in 2004, and a survey referred to as the ACOPE survey was undertaken in 24 young people with CKD during the time they were hemodialyzed or on hemodialysis, and 1 year following renal transplant. Findings in this investigation highlighted that transplant status, so for example, anxiety with regard to transplant rejection and faith were related to coping strategies. A variety measures were implemented to also record family running coping processes and behavior in youngsters across disease groups. And groups included young people with kidney disease who have similar clinical backgrounds to young people with primary immune disorders, and a healthy comparison group. One of the important findings relating to school absences in both primary immune disease disorders and renal disease or kidney disease cohorts skipped on average 2 weeks of schooling per day, schooling days per year owing to ill health, compared to 7 days conveyed for young people in the healthy contrast group. The team also highlight that this may be directly related to the youngsters' lack of coping strategies or processes, and amount of hospital appointments documented and by families in the ill health cohorts. So, in around theme 3 and the barriers to the understanding of coping in young people with CKD, the majority of measures aimed at assessing how young people cope do allow young people to complete the surveys unaided, whereas some may require additional aid by or parents or next of kin. Assessment of coping poses unique problems in young people with CKD. Young people may interpret questions differently to adults and have dissimilar perspectives regarding the course of disease. In addition, the aptitudes to inform using measures, understand terminology, and routinely complete measures as within adult healthcare investigations may be affected by development. Traditionally, in both clinical and research work, the assumption that adults can answer for young people has gone unchallenged. However, young people have their may have an exclusive viewpoint on coping, which may be influenced on existing life, earlier familiarities, dreams plus aspirations. The adolescent coping orientation for problem experiences, or ACOPE, is a 54-item self-reporting measure. In one particular study, the ACOPE survey was utilized to identify coping strategies utilized by 35 youngsters with renal disease or kidney disease, aged between 13 years and 18 years, 9 of whom were 13 to 14 years, 10 were 15 to 16 years, uh, and uh, uh, and 16 were 17 to 18 years of age. There were 20 males and 15 females. The bulk of participants were post renal transplant patients. Post renal transplant patients. Findings indicated that young people with CKD face specific demands which may be episodic or ongoing depending on health circumstance, and ultimately coping processes in young people ultimately coping press uh, ultimately coping in processes in young people with CKD. Acquiring information from young people continues to be challenging clinical work. Youngsters may not be able to understand a question, for example, or only provide answers adult healthcare professionals, sorry, want to hear. An IT format or version of the strengths and difficulties questionnaire had been established, implementing similar vernacular as the paper version, but it had visuals exemplifying individual questions. Youngsters who finished the IT style considerably conveyed the questionnaire was easy to complete than those young people completing the paper version. The computer-based edition is therefore had been edition is therefore had been an improvement on the current sort of the current based the current based paper format. A study by investigator Cairns assessed coping utilizing a series of measures in youngsters with CKD. 12 young people with CKD. Six of the young people were on hemodialysis as a form of renal replacement therapy, and six were on a form of on peritoneal dialysis as a form of renal replacement therapy. Were recruited or participated. The age range was from 10 years to 19 years, and the investigators implemented a variety of measures, including the Nowicki Strickland Children's Locus of Control scale, the Pierce Harris self concept scale, and the adolescent, again, the adolescent coping orientation problem experiences measure. And this study, the investigation highlighted that young people on peritoneal dialysis were more likely to show self reliance and further probable to cultivate bonds than those on hemodialysis. And this may be because there is less restriction on this form of renal replacement therapy. The author the author the authors the author or the authors highlighted that denial of challenges have been found in young people with such a with have been identified or found in young people with CKD, and summarized structured interview techniques are also required in a large number of youngsters in this population, which was also a finding in a similar investigation by Zeltzer. Young people are perceived as unpredictable respondents who may lack the verbal and perceptive ability required to comprehend to different surveys. For example, in many cases, it may well be that young people are too poorly to complete surveys. Ironically, it is especially in these cases that evidence on youngsters' health-related quality of life is most critical. A recently development sorry a recently developed survey or works had been the generic children's quality of life measure, which had been used to assess sort of the perceived quality of life in young people between ages 6 and 14 years, and the uh, the uh, the generic children's quality of life measure is not disease specific, but it had been implemented in a young renal population, and the generic children's quality of life survey or survey has an inviting layout and can be used to compare young people across age ranges in follow up investigations. So that draws this audio podcast to a close. This has been an audio podcast as part of the Calyces Chronicle series. This audio podcast as part of the MaelZtorm Cortex. This audio podcast as part of the Labanostics analysis, and this audio podcast as part of a Storm Robotics production.